Live from Studio 2A in PIX Plaza, this is the PIX 11 News at 6 with Tamsin Fidel and John Muller.
Yeah, what lies beneath the surface? A new study raising the red flag on deadly skin cancers. Cases among young people are on the rise, but the steps we take to protect ourselves haven't changed a whole lot. We're going to show you why you need to rethink the way you enjoy the sun.
Well, the number of skin cancer cases has doubled in the last 20 years, and the stats are really frightening. But now doctors are saying that patients are being diagnosed at younger and younger ages. Adding to all that, a new study says that moles are not the only telltale sign of melanoma. PIX 11's Narmeen Chaudhary explains why experts are saying it's time for a little refresher on skin education. It is tonight's cover story.
I don't think anything can prepare you to hear those words.
At just 27 years old, Caitlin King found herself at the dermatologist's office, stunned.
It was terrifying. I started crying and I didn't even expect it.
Years of growing up basking in the sun and then going to tanning salons sometimes as many as 2 times a week, it seemed may have caught up with her. At her young age, she was diagnosed with skin cancer.
We were at the beach all the time, and I know that I just did not properly protect my skin.
Yeah, what did you put on, if anything?
If anything, you know, a 20, 25.
But according to Dr. Bruce Katz, a clinical professor of dermatology at the Mount Sinai School of Medicine and the director of Juva Skin and Laser Center in Manhattan, the number of younger patients to this office is rising. Still, too many are going to tanning salons and baking in the sun with little to no protection on their skin.
It's really serious. We're seeing more and more of our younger patients in their 20s even developing skin cancers or even precancers. So this is really an epidemic.
What's even more frightening is a new study which reveals skin cancers are more likely to appear on normal skin and not on those moles we've now become so conditioned to monitor. That was the case for Caitlin.
It was a scab of sorts, kind of, you know, like a small pimple or a scab, and I just didn't associate that look to skin cancer. You know, you hear about moles a lot and different shades of colors of freckles and moles. So I just didn't associate what I had with you know, skin cancer.
Typical skin cancers don't necessarily come from moles. They can come by themselves, you know, a normal skin, and all of a sudden there's something there that doesn't heal or looks abnormal.
Cancer from moles, according to the study, only accounts for 20 to 30% of melanoma cases, and they may even be more aggressive.
In the last 30 years, the incidence of melanoma has doubled, and that's also a very scary number. I think it's very exasperating to think that so many people still go to tanning parlors. We know that it's dangerous, we know that it increases your risk of skin cancer and premature aging, yet people continue to do it. But young people still think that it cannot happen to them.
Caitlin was one of those people. Today, however, you won't catch her without sun protection.
To have something like this kind of puts the scare in you, and you just imagine it could be something worse is not something you want to mess with.
So, Tamsin, right there, the preventative measures are the obvious, the ones we've always talked about: sunblock, sunscreen, wear, you know, longer sleeve clothing when the sun's hot. 10 to 3 p.m. you should probably stay away from direct sun contact. But also, one interesting point the doctor brought up was that you should go to your dermatologist as an annual visit, just like you would to your physical exam. Right. I didn't think about that. That's not something I do. I don't know if you do.
I mean, it's shocking because I think you go to the dermatologist when there's a specific problem,
always,
not as a, you know, that's like a specialist doctor, right?
Absolutely. That's how I think about it. But he says that's part of the reason he feels that there needs to be a re-education about skin cancer, especially with this new study. When you're no longer just looking at those moles, but instead all over your skin, these experts can actually detect those abnormalities on your skin that could potentially be something life-threatening.
Really good information heading into the summer. Narmeen, thank you so much.
Thank you.